Hi there, this is Dr. John Whitcomb doing a news and nutrition update on Free of Cancer, the AMAS test, AMAS. What is that test? It's an interesting concept. Just about every cancer on this planet has a protein called malignin. And malignin gets higher as your cancer progresses. And there's a little bit of a catch, and that is once you are being overwhelmed by the cancer and pretty obviously very ill, it starts to fall. So it isn't a perfect linear progression with disease. It goes up and then it collapses. And basically that's an antibody to malignin that you're testing. So the AMAS test is an anti-malignant antibody test. How accurate is it? Well, if you take some 1,027 people who have known cancer, 92.7% of them have a positive test, and their blood level will be roughly 270. If you take a bunch of folks who are outpatient in a hospital, their level will be around 60. If you take control group that are known free and not going to a hospital, their level will be 55. So you see there's quite a range of difference. 270 going down to just 60, there's quite a range. So roughly in the middle of 150-ish is considered normal. 165 and below is considered normal. Now if you have somebody who has known cancer and they're below 165, 90% of them will be dead within a year. How do you want to use that test? Simple. It's not expensive. It gives you information. It lets you know if your interventions are working. Now, Google it. Look up AMAS test, and you'll find that the world of traditional medicine is quite disparaging about it, and that traditional oncologists don't use it. Why? I don't know. I think the concept is brilliant. But like all medical tests, it's got a little bit of false positive and false negative, and you need to know that and put in the context of judgment. And it's probably the most useful if you use it repeatedly and get repeated ongoing assessments. What will work for me? I'm using it in my practice. I've got patients who are using it, and it's a useful tool. It's not perfect, but it gives you information that allows you to plan ahead, allows you to see how you're doing, and it can catch things way before you see them clinically, as opposed to just wait and see. I like that idea. This is Dr. John Whitcomb talking about the AMAS test. Read Jenny Herbeck's book, Free of Cancer. You can read more about it.